Living with a connective tissue disorder can feel like an endless battle against pain, inflammation, and the uncertainty of what each day will bring. If you've ever found yourself wondering whether there's something, anything, that could help ease the relentless discomfort, you're not alone. For many, finding effective relief feels like a never-ending journey, with traditional treatments often falling short and sometimes bringing unwelcome side effects. Imagine another option, one that directly addresses the pain and inflammation at the core of your condition. Cannabis, a once misunderstood plant, is now emerging as a promising tool in the fight against chronic symptoms. And this isn't just speculation. Research is beginning to shed light on how cannabinoids, the active compounds in cannabis, might offer real, tangible benefits for those living with connective tissue disorders. At the heart of cannabis's potential lies the human body's endocannabinoid system, a complex network within us responsible for regulating pain, inflammation, and other critical functions. This system is made up of receptors, enzymes, and naturally occurring cannabinoids produced by our bodies. Cannabinoids like THC and CBD, which are the active compounds in cannabis, interact with this system by binding to specific receptors known as CB1 and CB2. CB1 receptors are primarily found in the brain and central nervous system, while CB2 receptors are more common in the immune system. When these cannabinoids from cannabis bind to the receptors in our endocannabinoid system, they can change how pain signals are sent and received within your body, effectively altering the release of neurotransmitters and other signaling molecules. For example, when you experience pain, your nerves send signals to your brain that say, "This hurts." Cannabinoids can step in and change how those signals are processed. So instead of feeling sharp or intense pain, your brain interprets it as something less severe. In simpler terms, cannabinoids can turn down the volume on pain signals, making them less overwhelming. This isn't just about covering up the pain. It's about helping your body perceive pain in a way that's easier to manage, a nuanced process, rather than just flipping an on-off switch. Pain and inflammation are closely linked, particularly in connective tissue disorders, where inflammation often exacerbates symptoms. CBD, in particular, directly targets inflammation at its source by suppressing the production of pro-inflammatory cytokines, signaling proteins that tell your immune system to ramp up its inflammatory response. By decreasing cytokine levels, CBD can help prevent the immune system from overreacting, which is crucial in conditions like lupus or rheumatoid arthritis, where the body mistakenly attacks its own tissues. This reduction in inflammation may lead to fewer flare-ups. Over time, it could also mean less tissue damage, potentially slowing the progression of your disorder. Cannabinoids also impact your neurobiology, offering potential relief beyond physical pain. Chronic pain isn't just a physical sensation. It takes a significant toll on your emotional and psychological well-being. This is where the interaction between cannabinoids and neurotransmitters like serotonin and dopamine comes into play. These neurotransmitters are closely linked to mood and stress levels. By enhancing their activity, cannabis can help alleviate the anxiety, stress, and depression that often accompany chronic pain. This isn't just about feeling better mentally. It's about breaking the vicious cycle where pain feeds stress, and stress, in turn, amplifies pain. Numerous clinical trials have demonstrated that these effects are more than just theoretical. When patients with chronic pain conditions, including those caused by connective tissue disorders, use cannabis, they often report significant improvements in their ability to perform daily activities. This is crucial because the pain and stiffness associated with these disorders can severely limit mobility and function. The reason cannabis can help in this way is tied to its dual action, reducing pain perception while simultaneously lowering inflammation. By addressing both the underlying causes and symptoms, cannabis may help restore the function that pain has stolen, allowing you to reclaim more of your daily life. To fully understand cannabis's impact on inflammation, we need to look at its effects at the molecular level. In addition to reducing cytokine production, CBD also inhibits the migration of immune cells to sites of inflammation. This is particularly important in connective tissue disorders, where immune cells can cause significant tissue damage. By slowing down or preventing this immune cell migration, CBD can protect your tissues from further harm, offering a more precise and targeted way to manage your condition compared to broad-spectrum anti-inflammatory drugs like corticosteroids. While cannabis shows promise for managing connective tissue disorders, it's crucial to maintain a balanced perspective. While current research supports cannabis for managing pain and inflammation, studies specifically on connective tissue disorders are still in early stages. Most studies focus on broader chronic pain conditions rather than specifically on connective tissue disorders, which is a key limitation. While relevant, these findings may not fully capture the unique challenges of CTDs, highlighting the need for more targeted research. While evidence for cannabis's anti-inflammatory effects, particularly CBD, is compelling, the long-term effects of managing chronic inflammation with cannabis are still unclear. The interaction between cannabinoids and the endocannabinoid system is complex, and responses to cannabis vary widely based on factors like genetics, past use, and the specific connective tissue disorder. This variability means some patients find significant relief, while others may not or may experience different side effects. While trials show cannabis can improve daily activities in chronic pain patients, these studies often have small sample sizes and short-term outcomes. Larger, long-term studies are needed to fully understand its impact on quality of life for CTD patients. The regulatory and legal landscape for cannabis varies widely, impacting access and quality depending on where you live. If considering cannabis, work with a healthcare provider to ensure its use is safe, legal, and tailored to your needs. In conclusion, while cannabis offers a promising option for managing CTD symptoms, it's vital to be aware of current research limitations and approach treatment with caution. Staying informed and working with healthcare professionals helps balance potential benefits with the need for ongoing research and careful consideration of all options.